mysterious hepatitis A outbreak is spreading across LA County, infecting people with no clear risk factors. Officials are alarmed by rising cases in the general population. 7 patients so far have died. Health experts say something's going on, but they don't quite know what. Our Fox 11 medical contributor, Dr. Michael Daigneault, back now with more on that. Dr. D, good to see you.
You too.
What's going on here?
Yeah, so usually with hepatitis A, it's from travel overseas that people ended up getting infected. So this is a sort of a homegrown outbreak that's going on right now. And I think, most people want to know what their risk is. And I think for the general population, a lot of people have already been exposed at some point, or they may have been vaccinated and just not know because of their job or whatever. For most people, it's a self-limiting illness, meaning you get sick for a few days and then you recover and then you have long-acting, antibodies and protection. But people that are high risk, particularly those with liver disease, so cirrhosis, hepatitis B, hepatitis C, those are the ones that are going to be at high risk, and those are the ones that probably should be vaccinated. But for the most part, if you're low risk and you just want to know if you have immunity, you can go get tested. It's the immunoglobulin G, which will tell you if you've been infected or vaccinated in the past. And if your titer is positive for that, you don't need to be vaccinated.
You don't need to be vaccinated?
For most people, yeah.
Okay.
But if you're unsure, just get checked.
Let's talk about what you're seeing in the emergency room. I know you're seeing some folks who have suffered strokes and don't even know it.
Yeah, so commonly everybody remembers the FAST mnemonic, which is facial droop, arm or leg weakness, or both, one side of the body, or speech difficulty. But the stroke symptoms that people forget that I see all the time is if you have severe dizziness or vertigo. Even if you suffer from vertigo in general, never assume that it's just that vertigo. So you can have a posterior circulation stroke that can cause severe dizziness, falling to one side, or vision loss. Those are stroke symptoms, and you should get checked out immediately, because in the ER, there are 2 interventions that we can do. If you come in within the first 3 hours, we can give you thrombolytics, which is a clot-busting medication. And if you're there within 24 hours, you go for thrombectomy, which means the neurosurgeon will go in and physically remove the clot. So don't ignore those symptoms, the dizziness, vision changes, as we can see on the screen here, the first 2, the loss of balance, headaches, dizziness, and then any kind of visual abnormality, blurred vision or loss of vision.
So that BE, a lot of people don't think about.
Be fast.
Yeah,
yep.
Be fast, and then that makes a difference. And you see huge impact when you get that medication.
Especially if you come within 3 hours. That's critical. Please don't wait.
Yeah. Something interesting here. I mean, you look pretty strong these days. I mean, you work out pretty hard. For those of us that are trying to look more like you, there's new research when it comes to protein, because a lot of people are told don't eat anything before bed, but this is saying something different.
Yeah, you're right to refer to that age-old wisdom of trying not to eat before you go to bed. But this was a really interesting study. It was a journal of, I think, clinical nutrition. Basically, if you consume 40 grams of protein about 30 minutes before you go to bed, in this study, those that did that, they had a 22% increase in muscle protein synthesis. So that's just muscle building hypertrophy overnight. The key is you want to get a slow absorbing protein called casein. It's C-A-S-E-I-N, or, honestly, any number of protein powder. What we like to do is, most of the protein powders are about 20 grams per scoop. You can make a smoothie, you can just add water to it, down that, and then do another scoop and another smoothie. And that will give your body the amino acids over the course of the night to make more protein. And the key is the slow absorbing. So that protein will do that over 6 to 8 hours. And this isn't even just for people that go to the gym. This is for menopausal, postmenopausal women who really need to combat osteoporosis and to make sure their bones are strong to prevent any kind of trauma from falls, like hip injury and such like that.
So we were just showing a bunch of video of different protein sources, but you're saying it's better to not even do the food, just do the protein powder, because then it's just straight protein.
Yeah, because you should be hitting your protein goals during the day, eating regular, healthy, clean food. And at the end, that's when you want to save that protein powder for the end of the day, for this specifically.
Interesting. I will try that, and I'll let you know what the results
see what happens.
are.
Yeah.
All right, Dr. D, thank you so much.
Thank you.